The most dangerous sentence in Medicare is Medicare Advantage is free. It's not wrong. A lot of Advantage plans do have $0 premiums, but that sentence has caused more regret, more surprise bills, and more panicked phone calls to my office than anything else in the 7 years I've been doing this. And before you think I'm about to trash Medicare Advantage, I'm not. I enroll people in Medicare Advantage plans every single week. For a lot of my clients, it's the best decision they've ever made. And for a few others, it's the decision they'd give anything to undo. The difference between these two outcomes is one question that almost nobody asks before they enroll. And I'm going to give you that question in this video so you never end up on the wrong side of it. I'm Andy Childs, Medicare broker in Mesa, Arizona. 7 years in the business, so let's settle this. I need to reframe something before we go any further because every other video about this topic gets it wrong. They set this up as a fight, Advantage versus Original, Team A versus Team B. Like you're picking sides and one of them is a winner. That's not how this works. And the second you start thinking of it as which plan is better, you've already set yourself up to make a wrong choice. There is no better. There's only better for you right now. With your doctors, your medications, your health situation, and your budget. And those things, they change. What's right for you at 65 might not be right for you when you're 72. So here's what we're going to do. I'm not going to tell you which one to pick. I'm going to give you the one question that determines which path fits your life. Then I'm going to show you 3 real situations where that question gave 3 completely different answers. By the end, you won't need me to tell you what to choose. You'll know. Here's the problem with how most people make this decision. They compare premiums. They look at the monthly cost of a Medigap supplement, let's say $150, $200, and then they look at a $0 premium on a Medicare Advantage plan. And the math feels obvious. Why would I pay more when I could pay nothing? And I get it. On paper, that logic makes sense. Especially if you're on a fixed income and every dollar matters. But that logic only works if cost is the only variable. And it's not. It's not even the most important variable. I had a woman call me in tears this last October. She'd been on a Medicare Advantage plan for 2 years. Loved it. Low premiums, dental and vision included, gym membership. It's the whole package. Then she needed a hip surgery. Her orthopedic surgeon, the one she'd been seeing for years, the one she trusted, wasn't in the plan's network anymore. That network changed at the start of the plan year, and she was not aware of that. She found out when she tried to schedule the surgery. Her choice was either switch to a surgeon she never met, or pay for the entire procedure out of network, which her Advantage plan would barely cover. She called me and she said the 5 words I've heard too many times. Nobody told me this could happen. That's the cost that doesn't show up in the premium comparison sheet, and that's what this video is about. Here's the question. It's simple, but it changes everything. How important is it to you that you can see any doctor you want anywhere in the country without asking permission first? That's it. That's the whole decision tree. If your answer is, that's non-negotiable. I want to pick my doctors, I want to see specialists without a referral, and I don't want a network telling me where I can go, then Original Medicare with a supplement plan is your path. Full stop. If your answer is, I'm flexible, I have doctors I like, but I'm open to working within a network if it saves me money and gives me extra benefits, then Medicare Advantage is the right fit for you. Neither answer is wrong, but you have to answer it honestly. Not based on what sounds cheaper, but based on how you actually want to use your healthcare. Let me show you what this looks like in real life. I had a client last year, a retired firefighter, 70 years old. He lives here in Mesa. He's a healthy guy, he rarely goes to the doctor, and his main concern was cost. He didn't have a cardiologist. He didn't have an oncologist. He didn't have a list of specialists he needed to keep. He just wanted solid coverage at the lowest price. I enrolled him in a Medicare Advantage plan, no premium, $0, and his primary care doctor was in the network. He got dental, vision, silver sneakers gym membership, over-the-counter card. A year later, he told me this was the best financial decision he'd made in his retirement. That's a real Advantage success story, and they exist. But here's what made it work. His answer to the question was honest. He genuinely didn't need the network freedom. He didn't have complex medical needs. He wasn't attached to a specific specialist. The Advantage model fit his life. So let's look at the other side of things now. The firefighter's story worked because his healthcare needs were simple. But the second your needs get complicated, the Advantage model works differently. And differently can mean more expensive than the Medigap plan you were trying to avoid. Here's how. Medicare Advantage plans have a feature called prior authorization. Before certain procedures, tests, specialist visits, the insurance company has to approve it first. They're essentially saying, we need to decide if this is medically necessary before we agree to pay it. On original Medicare, there's no prior authorization for most services. Your doctor says you need an MRI, you get an MRI. Your doctor says you need to see a cardiologist, you see a cardiologist. On Advantage, your doctor says you need an MRI. The insurance company says, let's review that first. Sometimes the answer is yes. Sometimes the answer is we need more documentation. And sometimes the answer is no. We don't think that this is necessary yet. I had a client, 76, a retired nurse. She knew healthcare inside and out. She was on a Medicare Advantage plan because the benefits were generous and the premium was zero. It was a smart decision for her at that time. Then she developed a heart arrhythmia. Her cardiologist wanted a specific imaging study to determine if she needed a procedure. The Advantage plan denied the prior authorization, said the standard EKG was sufficient. Her cardiologist disagreed. She appealed. It took 11 weeks. 11 weeks of waiting to find out if her insurance would let her get the test her doctor said she needed. She called me during week 6. She said, Andy, I'm a nurse. I know what this test is. I know why I need it. And I'm sitting here waiting for an insurance company to decide if my doctor is right. After the appeal was approved and she got the test, she switched to original Medicare with a supplement plan right as soon as she could during the next enrollment period. Her monthly premium went up, but she didn't care. She told me, I'll pay more to never wait 11 weeks for permission again. That's not an Advantage failure. That's an Advantage feature working exactly as it's designed. Prior authorization is how Advantage plans keep premiums low. It's a trade-off, and it's a trade-off you need to understand before you enroll, not after. Here's the thing I want you to hear clearly. Prior authorization is not evil. It's a cost control mechanism. For healthy people with simple needs, it rarely comes up. For people with complex or chronic conditions, it can become the defining experience of their plan. So when I ask you, how important is it that you can see any doctor without permission? This is what I'm really asking. Are you in a place with your healthcare where you're willing to trade network freedom and prior auth flexibility for lower premiums and extra benefits? Or are you in a place where you need your doctor to be the one making the decisions, not the insurance company? There's one more thing I need to tell you, and this is the one that catches people completely off guard. If you start on original Medicare with a supplemental plan and later decide to switch to Medicare Advantage, you can. That switch is available to you during open enrollment period every year, October 15th to December 7th. But if you start on a Medicare Advantage plan and later decide to switch to original Medicare with the supplement, you might not be able to get the supplement plan you want. Here's why. When you first enroll in Medicare Part B, you get a 6-month Medigap open enrollment period. During those 6 months, insurance companies must sell you a supplement plan regardless of your health. Must. No medical underwriting. No question about pre-existing conditions. They have to accept you. After that 6-month window closes, supplement plans can and do medically underwrite you. That means if you've been on Advantage for 5 years and you want to switch to a supplement plan, the insurance company can ask about your health history. If you've had cancer, heart disease, diabetes, or any significant condition, they can charge you more or deny your coverage entirely. I had a client, 73, been on Advantage since she turned 65. Great plan for the first several years. Then her plan's network shrank 2 years in a row. Her primary care doctor stayed in, but 2 of her 3 specialists dropped out. So she wanted to switch back to original Medicare, and she applied for Supplement Plan G, which is the most popular supplement. Denied. She had breast cancer diagnosis at 69. Treated successfully, it was in remission, but the Medigap insurer said her health history made her too high risk, so she was stuck. Advantage plans she didn't want anymore, and no supplement plan would take her. There are some state-level protections in Arizona that can help in specific situations, and there are guaranteed issue rights that apply in certain circumstances. But the broad protection you had during that first 6-month window, it's gone. This is what I mean when I say the Advantage to original path has a trapdoor. Going in is easy. Coming back out can be hard. It depends entirely on your health. This doesn't mean you shouldn't choose Advantage. It means you should choose it knowing this fact, not discover it years later when you're trying to leave. So here's the framework. 1 question. How important is unrestricted doctor choice and no prior authorization? If that's your priority, original Medicare with a supplement plan gives you the most freedom. Higher monthly premium, fewer extras, but your doctors make the decisions, not the insurance company. And you can see anyone, anywhere. If cost savings and extra benefits are your priority and you're comfortable with a network, Medicare Advantage will be an excellent choice. Lower premiums, dental, vision, hearing, but you're trading flexibility for those savings, and prior authorization is a part of the deal. And remember that trapdoor. Going from original to Advantage is easy. Going back from Advantage to original can be more difficult and might require underwriting. So choose with that in mind. If you're sitting here thinking, I don't know which one is right for me, that's normal. And that's what I do for a living. I'm an independent broker. I'm not employed by an insurance company. I don't get paid more to put you on Advantage versus original. I represent multiple carriers, and my job is to match you to the plan that fits your actual life, not the plan that has the best TV commercial. So if you're in Arizona, my contact information is in the description. It's free. It's always free. Subscribe because the next video answers the question I get most after this exact conversation. See you there.